Hello everyone, my name is Shanasia Combo. Today I will be doing the Medical Terminology Project 3 presentation and giving you guys 15 terms from different medical terminology chapters in our textbook. So let's go ahead and get right into it. The first word is erectile dysfunction. It's the inability to achieve or maintain an erection sufficient for sexual activity. An example of this will be a 50-year-old male with diabetes, and he may experience ED due to nerve damage or poor blood flow. The second word is vasectomy. It's a surgical sterilization procedure, cutting off or sealing the vas deferens of a man's testicles to prevent sperm from entering semen. An example of this will be a 35-year-old man opts for a vasectomy as a permanent birth control method for him and his partner. The third word is cervix. A cervix is the lower and narrow part of the uterus connecting to the vagina. An example of this is during childbirth, the cervix dilates to allow passage of a baby. The fourth word is ovulation. Ovulation is when a release of a mature egg from the ovary, typically occurring mid-menstrual cycle, happens. Example, tracking basal body temperature helps predict ovulation for conception. And ovulation can increase the chances of having a baby or conceiving a child through sex. The fifth word is endometriosis. It's a growth of the uterine-like tissue outside the uterus, causing pelvic pain and infertility. An example of this is a 30-year-old woman with severe menstrual pain, and she is diagnosed via surgery. Also, this condition can also happen to younger women. It's more common in younger girls with PCOS or just problems with irregular periods, and is diagnosed very broadly with younger women with those type of symptoms. I think we're on the sixth word. The sixth word is hysterectomy. A hysterectomy is a surgical removal of the uterus. Sometimes it includes ovaries. A partial hysterectomy would just be removing the uterus and keeping the ovaries in the woman's body, but a full hysterectomy is a surgical removal of the uterus, ovaries, tubes, everything. An example of this will be a 45-year-old woman that undergoes a hysterectomy to treat fibroid tumors or a chronic case of endometriosis. Another word is uterus. The uterus is a hollow muscular organ where a fertilized egg implants and develops into a fetus. An example is the uterus expands significantly during pregnancy to accommodate fetal growth. Another word is testicular torsion. It's a twisting of the spermatic cord, cutting off blood supply to the testicles. An example is a teenager with sudden scrotal pain and requires emergency surgery to have the doctor save the testicle. Another word is mammogram. It's an X-ray imaging of breast tissue to detect abnormalities like tumors. An example is a routine mammogram screening for breast cancer is required for women over 40. Another word is pregnancy. Pregnancy is a condition of carrying or developing an embryo or fetus in the uterus. An example is a positive home pregnancy test confirms implantation of a fertilized egg. You can also confirm pregnancy through blood testing, and you can also confirm it through radiology, so like a ultrasound or something of that nature. Another word is gestation. Gestation is a period of fetal development from conception of birth. It typically lasts 40 weeks. 40 weeks is the normal time for a baby to fully develop and for a woman to give birth. Anything under that would be considered premature. An example is preterm birth occurs when gestation ends before 37 weeks, like I said. So anything under 40 weeks of gestation is typically abnormal for a woman in her pregnant pregnant period of her life. Another word is menopause. It's a succession of menstrual cycles for 12 months, making the end of fertility. An example of this is a 52-year-old woman experiencing hot flashes or irregular periods before menopause. Another word is STI, sexually transmitted infection. Infections spread through sexual contact, such as chlamydia or HIV. An example is condom use reduces STI transmission risk. A lot of people confuse STI with STD. So a STI is a sexually transmitted infection, and usually a transmitted infection can be cured with an antibiotic or an anti-parasitic. A STD, which is a sexual transmitted disease, is something of the nature of like hepatitis, HPV, herpes, and HIV, which cannot be cured with any kind of antibiotic or anti-parasitic or antiviral. It's just something that people tend to live with. Now, there is medication to kind of reduce the symptoms and also protect the person from getting it from the person that is infected. So that's really what happens when it comes to STI and STD. The other word is cesarean section, which is also called a C-section. A C-section is a surgical delivery of a baby through an abdominal and uterine incision. An example is a C-section is performed if vaginal delivery risks maternal or fetal health. So most mothers that go through a C-section are commonly in risk of dying, or they have a health condition, or sometimes it can be even as worse as an STD. If a mother is infected with an STD or an STI, she cannot under any circumstances have the baby natural. She has to undergo a cesarean section, because if not, it can lead to developmental risk for the baby. The next word is infertility. Infertility is the inability to conceive after 12 months of unprotected intercourse. An example is a couple undergoes fertility testing due to ovulation disorders or a low sperm count. So low fertility doesn't only happen in women. Men can be fertile as well. Just like women can be fertile and we go through ovulation. Now, men cannot go through ovulation because they don't have a period, they don't have a menstrual cycle, and they don't have a uterus. But just how women have eggs, men have sperm. And these sperm cells and these egg cells are what make us fertile, because we don't fertilize each other, but the man fertilizes the woman. And when we are fertile, it makes space to make a baby. Now, if either of the people in the relationship are infertile, that can cause problems with making a baby. And this can happen to the woman or the man. Most people think that women can just be infertile, and that's not true. Men can be infertile, and the reasons that men are infertile compared to why women are infertile are completely different. Women can be infertile due to stress, hormones, diets, etc. Men can be infertile due to smoking, stress. It's a lot of factors that play into why men can be infertile. But for the most part, it can be fixed just with some lifestyle changes in both parties that involve themselves in trying to make a baby. So, yeah, but that's all the words that I have for this project. And I hope to enlighten you guys with some more words for our next project, if we have a next project. But thank you so much for listening to my presentation. Bye-bye.